Think of your lumbar spinal canal as a comfy hallway for nerves. Now imagine someone cramming that hallway with a bunch of extra furniture. Suddenly it's tight and awkward. This entire space is reduced or tightened, and when this happens in the spine, specifically in the lumbar vertebrae region, it is called lumbar spinal stenosis, LSS for short. It's like a traffic jam. But this time, the road is the lumbar spinal canal, and nerve passes through it. The nerve highway is hit with rush hour, basically leaving them squeezed, compressed, and unhappy. You know what nerves do when they're not happy? If you don't, then you should stick till the end to find out. This is Witty Med, where mastering medicine is easy and fun, because why not? So if you haven't subscribed, do so now. It cures 99% of boredom. The other 1% is reserved for your cousin's graduation speech, and nothing can take that away. Now skip to the good part. Imagine you're minding your own business, then suddenly, bam! Pain in your back, butt, or legs, especially while standing or walking. Sitting down is the ultimate spine timeout, instantly relieving the pain. This isn't your typical ouch moment. This is called neurogenic claudication, which is one of the many complications of LSS. You remember the traffic jam, tightening, and narrowing we talked about earlier? Yeah, LSS. It squeezes your nerves because it literally makes the nerve passages tight. Well, the squeezing leads to pain called neurogenic claudication. This pain throws shades even when you're just standing still, like it's saying, "You thought you could stand there while I get squeezed?" Well, think again. Honestly, if you ain't experiencing this, consider yourself super lucky. Luckier than a chicken at a vegan barbecue? You must have heard of other types of claudication, but not all claudications are created equal. Unlike vascular claudication, which needs walking to stir up trouble, neurogenic claudication loves to mix things up by being triggered just by standing still. Also, unlike lumbar disc disease, where sitting can sometimes be uncomfortable, LSS loves sitting because it creates more space and reduces the tightness, so it practically throws a party for you when you sit down. Here's where it gets weirdly hilarious. LSS sufferers can suddenly walk much farther when leaning over a shopping cart. Why? Those flexed forward positions, like hunching over a cart or pedaling a stationary bike, opens up the spinal canal just enough to take the pressure off the nerves. It's like giving the spine a much-needed breather. Sometimes the nerve drama goes beyond pain. It can lead to other complications such as weakness, like your legs just got lazy, tingling or numbness, your body's way of saying, "Hello? Anyone there?" Or in case of numbness, it decides to just hit airplane and not connect with you. Reflex changes because reflexes are simply your body's instant snapback reactions, quick and automatic. When lumbar spine stenosis squeezes the nerves in your lower back, it messes up the signal highway. This can make reflexes slower, like a delayed reply, or sometimes even exaggerated because the nerves aren't getting the message right. It's like a glitch in your body's Wi-Fi. While LSS is mostly a pain-in-the-back drama, it can occasionally turn into a full-blown thriller. Severe cases may lead to paralysis or urinary incontinence, but don't worry. Those plot twists are super rare. LSS isn't that mean most of the time. How common is this party? Turns out LSS isn't exactly exclusive. 6 to 7% of adults have it. And surprise, most of them don't even know because it's just chill in there, asymptomatic. When symptoms do show up, they usually tag along with severe stenosis. What are the causes? Well, this is a case of nature and nurture. Some causes are congenital, born this way. Congenital forms like achondroplasia or idiopathic LSS. These involve short, thick pedicles, basically the architectural equivalent of a poorly designed house. Some causes are acquired, thanks life. In fact, LSS is mostly acquired, 75% of cases, because life and gravity are relentless. For the acquired causes, there's a buffet of contributors like degenerative conditions. Examples are spondylosis and scoliosis. Spondylosis is the wear and tear of the spine, kind of like how your favorite old jeans start to fray. The wear and tear causes the discs and bones to bulge or grow spurs, which can make the tunnel narrower. While scoliosis is when the spine takes a little twist or curve, like a roller coaster instead of a normal straight track. It can happen in different shapes, like an S or C. Scoliosis causes the spine to curve. It can make the space where nerves hang out a little too tight. Other acquired causes are trauma, previous spine surgery, metabolic and endocrine issues. Examples include epidural lipomatosis. Simply put, it's when the spine's personal space is being invaded by a fatty intruder who thinks it's a VIP guest. This extra fat presses on nerves and causes narrowing. Another example of a metabolic disease is osteoporosis, which is actually when bones get all thin, fragile, and out of game. So one wrong move and sometimes space gets narrowed. Another example is acromegaly, which is a condition where the body's growth spurt button gets jammed, making bones and tissues grow too big, squeezing the spine like an overstuffed suitcase. Next example is renal osteodystrophy, which is when bones have a meltdown because the kidneys fail to balance calcium, phosphorus, and vitamin D, so bones get weak and bendy, and when things bend, they sometimes get in the way. Then there is hypoparathyroidism, which is similar to renal osteodystrophy because it messes with the body's calcium levels, making bones weak and wobbly. This can lead to the spine getting squished and misaligned, causing lumbar spine stenosis. And there are rare players like Paget's disease, which, simply put, is when bones getting a little too excited about remodeling, they go way off the blueprint. Normally, bones break down and rebuild in a balanced way, but with Paget's, the rebuilding part goes into overdrive. This makes the bones grow bigger and weaker, kind of like a house with too many extra rooms and floors, but no solid foundation. And in this cause, it can tighten some space that really should never be narrow. If the spine's throwing a tantrum either because it's narrowed or for some other reason, MRI is the Sherlock Holmes of diagnostic tools. It can tell the doctor exactly what's going on in there. Short pedicles, narrow canals, the whole 9 yards. And there are other detectives in town, and we can call on them when the spine demand. Well, there is more to go, but we are taking a break time because we deserve it. And in the next episode, we'll crack the code on how to handle this condition. In the meantime, don't forget to like, share, and subscribe so I can brag to my friends that I am actually fun and opening a YouTube channel wasn't a bad idea. See you in the next video.